Why does snoring cause heart failure? This is incredibly high yield medicine concept, and before I start breaking it down, I will ask one question. What is snoring physiologically? Yeah, it's partial obstruction of the upper airway. What if that this obstruction becomes complete? Yeah, obviously, so you stop breathing and you develop a condition known as obstructive sleep apnea. And this is where the cardiac damage begins. So I will ask, what happens when someone stops breathing for 30 to 40 seconds at a time? Yeah, their oxygen levels drop, they become hypoxic. Let's take a step further, and I will ask that what does hypoxia do to the pulmonary vasculature? Yeah, it causes pulmonary vasoconstriction. It's actually a protective mechanism where lungs try to shunt the blood away from the poorly ventilated areas, and it's called pulmonary hypoxic vasoconstriction. But the problem is in obstructive sleep apnea, the entire lung is hypoxic. So you get diffused vasoconstriction instead of localized vasoconstriction. So if this is happening hundreds of times per night, every night for years, you develop chronic pulmonary hypertension. And for years, and when right heart has to pump the blood against an elevated pulmonary pressure, what happens? Obviously, it hypertrophies, then it dilates, and then finally it fails. And you develop a condition called cor pulmonale, which is nothing but right heart failure from lung disease. But this does not just stop there. When someone tries to breathe against a closed airway, it creates a massive negative intrathoracic pressure, which increases left ventricular afterload, and sympathetic surges from hypoxia lead to systemic hypertension and cardiac arrhythmias. The left heart failure too, along with right heart failure. So for the USMLE, if you come across a scenario where they talk about a patient having morning headaches, daytime sleepiness, loud snoring, witnessed apneas, and now the patient has severe systemic hypertension and an unexplained heart failure, and now some students will confuse this and think immediately of ischemic cardiomyopathy. Well, it's actually, you should know that uh, obstructive sleep apnea, and we should go for polysomnography, which is the gold standard to diagnose this. And then we have to put this patient on CPAP, continuous positive airway pressure, which actually reverses the cardiac dysfunction in these patients as well.